Hey everyone, today I'll be talking about diabetes mellitus. Diabetes mellitus is a disorder characterized by high levels of glucose in the blood. An individual is said to suffer from diabetes mellitus if his or her fasting plasma glucose levels are more than equal to 126 milligrams per deciliter, or plasma glucose levels in a random blood sample or 2 hours after a 75 gram glucose load are more than equal to 200 milligrams per deciliter, or the levels of HbA1c are more than equal to 6.5%. The exact cause, or say the etiology of diabetes mellitus is not known, but it is known to have a strong genetic association. Risk factors involved with development of diabetes mellitus involve environmental factors such as diet and obesity, or can be associated with certain diseases such as disorders of the pancreas, or can be associated with consumption of certain drugs. Females can develop diabetes mellitus during pregnancy, which is known as gestational diabetes mellitus. But this type of diabetes mellitus subsides after the delivery of the baby. Diabetes mellitus is broadly of two types. First, what we have is type 1 diabetes mellitus, which is characterized by inadequate insulin production due to destruction of the beta cells of the pancreas. Second, what we have is type 2 diabetes mellitus, wherein the patient suffers from insulin resistance. A patient of diabetes mellitus can complain of the following symptoms. Either there can be complaint of excessive thirst known as polydipsia, or there can be complaint of excessive hunger known as polyphagia, or there can be complaint of excessive urination known as polyuria. A patient of uncontrolled diabetes mellitus can suffer from a lot of complications in the body. Short-term complications can include diabetic ketoacidosis and hyperglycemic hyperosmolar state. Long-term complications can include ocular complications such as diabetic retinopathy, or there can be renal complications such as diabetic nephropathy, or there can be complaints related to peripheral neuropathy such as sensory loss, or there can be vascular complications. Due to peripheral neuropathy and vascular complications, the individual of diabetes mellitus can suffer from certain foot diseases such as diabetic foot ulcers due to repeated injuries. Diagnosis of diabetes mellitus is based on the levels of glucose in the blood, parameters for which I have already discussed in the beginning of this video. Treatment of diabetes mellitus not only involves therapeutic management but also includes care from the patient side, which can involve having a healthy diet and also having certain lifestyle modifications such as regular exercise, weight reduction, and avoiding excessive consumption of alcohol. Patient education is must in a patient of diabetes mellitus. Therapeutic management of diabetes mellitus can involve the doctor prescribing you certain oral hypoglycemic agents or prescribing insulin with a proper dosage. So this was all about diabetes mellitus in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video, and subscribe to my channel. Also, you can check out my YouTube short on diabetes and driving. Thank you.